That is, the womb is no more alive. So because of that, that's why she has been having that fever and all those things, because only her knows what we don't know whether is it the infection from the contamination of the abortion, or is it there was anything. But the only thing is that when we open up, the womb is black. It cannot be remedied. A girl of 21 years, we remove the womb. It was a 17-year-old girl that is living with a relation who wanted to help them. The girl committed abortion without telling the caregiver. When they now brought the child, all effort, she said she didn't even know any man. And because she said she didn't know any man, you know, you have no right to do the vaginal examination on a virgin. You must use the virgin something. So do you understand? But the pregnancy test did, even though it was faint, but because she committed the abortion about 3 weeks ago. So when they were doing it in the local world, they used what they are doing in Duda, and they were removing the intestine, thinking that do you understand? The part of, so they perforated the womb, behind the womb. So they were taking those parts of intestine. So there were pus everywhere. So I was saying, when I was going, I thought it's perforated typhoid. You know, typhoid can perforate. But I was saying, this one will say that the pregnancy test is positive. This one will say that it's negative. So long as this woman is not stable, I'm taking her in. Only for me to take her in. Behold, there are multiple punctures on the womb. I don't know what the person that did the abortion for him, used. So, you know, that maybe is a sharp something. So it was puncturing the womb. So there was a place it was punctured through and took part of the intestine. Hey. So that was why she was leaking that feces. So what we did was, we first of all tried to do the one we can do. The part of the womb that looks not good, we have to remove that part. But thank God, she might still have she might still be able to carry a baby to term. Then we brought the general surgeons, who also joined us to do what? To repair the intestine. And she's doing fine. But because I was down, I said I went to start with the last, because I left after a few days, I didn't have the opportunity to go and ask that virgin what happened. But the only thing is that I know that she did very well. They have discharged her, and she's doing what? And then there's another one, challenging one that we had. A third-year student in Kaduna. I don't know one of the tertiary students in school. Now, the boy that she messed up with is just also her classmate, who can't do anything. But because she didn't say the truth, unfortunately, maybe in the course of doing the abortion or whatever, I don't know how they affected the womb. So the infection, you know, the womb became gangrenous. That is, the womb is no more alive. So because of that, that's why she has been having that fever and all those things, because only her knows what we don't know whether is it the infection from the contamination of the abortion, or is it there was anything. But the only thing is that when we open up, the womb is black. It cannot be remedied. A girl of 21 years, we remove the womb. We remove the womb. So she can never carry a child again. That's it. At 21, third year. So these are the things. So there are a lot of, especially we that are in the gynae or obstetric, you see a lot. You see a lot. This is no longer the time we say that a child needs to be 12 years or 14 years to start seeing menses. Now you see them 12 years, you already know what it is. Could you believe that you bring a child of 8 years to taste something? You see that there is no hymen. It looked like that of my mother. The whole hymen. That's why also men should also be very careful, because the children now can put them into trouble. Do you know that a child of 8 years can carry you, indirectly taking your hand to take it to a place you will not like? Because you have already started with even the people in the same primary school with her. And you, if you are the one that your hormone doesn't have control, you will put. When she will start naming, she will name you first. And we are gone for that. There is no way they will not bring a child less than 5 years that it has blood stain on the pant. At the end, either is the driver that came to pick the child that is fingering the child, or is the house help that is fingering, or the uncle in the school that is fingering the child. So there are a lot of things. So too many things. With regards to emergency, we have seen a lot. And also with regards to challenges when we are doing surgery, sometimes also because of this era of supplement, women are taking rubbish. Fibroid. Fibroid is a very sweet surgery. That it has this capsule, you're supposed to remove it without, but they will take all this rubbish they call their supplement. When you go there, you'll be sweating. Because that supplement they take will now destroy that normal capsule that will help you a good cleavage plate to remove it. You can't again, because you know we don't cut fibroid, you don't cut to remove fibroid. You're supposed, once you make that incision, you enucleate it. You enucleate fibroid, you don't cut, you don't excise fibroid, you enucleate. But when they take that thing, it will obliterate everything. So you can't even see, so you have to start cutting. And sometimes, you know, when you cut, the more you're cutting, the more the bleeding. Sometimes you end up losing the whole womb. Sometimes not only losing the womb, you lose the woman. And these are all these nyama things. Hey, no, you don't need to, you will take this one, you will shrink it, you will urinate it, you will do this. Now lie. If you don't want to, if your fibroid doesn't need surgery, it doesn't need surgery. If you don't want to do surgery, please don't take anything that you are taking it to shrink the fibroid, remove the fibroid. No. Because you are the one that will have the complication. Sometimes, because of that thing they take, it will have what we call mutation. It will have carcinogenic changes. And now people will say, naturally on its own, its rate is 0.02% for it to turn into cancer. But because of all these stupid things we are taking now, there are increased incidence of malignant changes. That is something that it looks like now become malignant. People don't tell the truth. You might even go that you are going to do appendix, only for you to open, you see a ruptured ectopic. There are a lot of things, a lot. So that's why I said, with time, we really need this awareness, advocacy. I think it will also go a long way for people that really want to have a change of heart, and live better. With regards to health, all of us should know that at certain age, there are some health challenges you will never run away from. That's why I always tell people, when you're still very young, you know, that time it's your parents that take care of it. Parents shouldn't be quick to turn themselves into doctors. Before somebody goes to the hospital, she must have consumed 3 different types of antibiotics, 3 different types of anti-malaria. So for that time, we must take care of them. Then as a young boy or a young girl, for women, you know that during our teenage, early, from teen to 20s, your hygiene matters. There are changes that will come. It's not sickness. That's why when you meet the appropriate person, will tell you, my menses used to be 3 days or 4 days, now it's 2. It might be just ordinary simple change. You now start going and taking stupid drugs. And that drug will be what you'll be suffering from, not that thing. Half knowledge is worse than no knowledge. I hope we know. Because somebody knows, I'm sorry, I don't know. Maybe you meet the person that knows. But the person that have the half don't believe that he has half. She thought that he have the full knowledge. Then, because at this stage, what we normally need most is what? Our hygiene. The problem that normally hover around what? Menses. Menses miss. Menses prolong. Menses do this. Menses is dark. Menses is this. Do you understand? These are the things. And when you understand yourself, it helps you better.